Good afternoon, everyone, and welcome. Good afternoon, colleagues. Welcome. On behalf of the Secretariat, the organizers of this session, that include UNICEF, FHI 360, JHU CCP, the Regional Working Group of the Summit, I welcome you to this afternoon's panel discussion on public sector leadership and social and behavior change. My name is Thaddeus Pennis of FHI 360, and I'm glad to be with you today. Today we have an exciting and interesting topic. Many pressing health issues and social issues today, such as the recent COVID-19 pandemic or gender-based discrimination, have emphasized the significance of public sector leadership and government adoption of social and behavior change approaches to influence public and private behaviors and social practices by creating an enabling environment for change. Governments worldwide have used various approaches and strategies such as incentives, bans, mandates, information campaigns, nudges to promote numerous areas of human interaction and change in numerous areas of human interaction. This panel discussion today sheds light on the role of public leadership as a catalyst for sustainable and social and behavior change in society, and provides some examples of government approaches, viewpoints, challenges to integrated SBC approaches, opportunities and ideas to aid SBC practitioners in advocating for inclusion and adoption of social and behavior change within the public sector. Planning, policy, and actions will be discussed throughout this panel discussion. Ladies and gentlemen, today we have a distinguished group of panelists and moderators today. First up, Dr. Da-costa Aboagye of the Government of Ghana. Dr. Da-costa is the Director of the Ghana Health Service Health Promotion Division. Dr. Aboagye is a national figure in risk communication and community engagement response for COVID-19. He led Ghana's national risk communication efforts during the pandemic and created the National Risk Communication and Misinformation Task Force for COVID-19. And may I also add, he's been recently elected president of the West Africa Risk Communication Advisory Body. Also, hopefully joining us today via a video link is Dr. Reham Rizk. Dr. Rizk is from the government of Egypt. She is the head of the Health and Social Planning, Dr. Rizk is head of Planning and Social Planning and Development Union at the Ministry of Planning and Economic Development, and is an associate professor of economics at the University of London and the master's program at Pantheon-Sorbonne University. Hopefully she'll be joining us via Zoom very shortly. Also on the panel today, we have Dr. Luis Arlette Saavedra Romero of the Government of Mexico. Dr. Saavedra is the Director of Strategies and Development of Healthy Environments with the Secretary of Health for the Government of Mexico. Trained as a medical doctor with degrees in epidemiology, public health, she has worked in the Ministry of Health in various functions and positions on health programs for women, preventative medicine, epidemiology, health system strengthening, and training, among others. Finally on the panel today, Dr. Abdelouahab Belmadani from the Government of Morocco. Mr. Mahdi is Director of Planning and Financial Resources for the Ministry of Health. He leads Investment Execution Monitoring Division and monitors the implementation of public-private partnership projects, the energy sector, and monitoring the execution of public health investment projects. Today's moderator is Ms. Naseem of UNICEF Morocco. Ms. serves as Deputy Representative for UNICEF in Morocco and is Head of Programs. Prior to this, she was the Deputy Representative for UNICEF in the Gulf and led UNICEF's program engagement in Bahrain, Kuwait, Qatar, Saudi Arabia, and the United Arab Emirates on child rights. In past years, she's worked for UNICEF in Lesotho, New York, and in Kenya on health, HIV, child protection, and adolescent development and participation. Ladies and gentlemen, please join me in welcoming our distinguished panel and moderator, and join me in welcoming them in today's discussion. Thank you.
Thank you very much for that introduction. I hope the microphone works. Thank you all for joining us for this important session after the lunch hour. Thank you again to the panelists for being with us for this discussion, and for all of you for making the time to be with us this afternoon. As we have discussed all along the past few days in your sessions, no doubt, one of the critical challenges we face in social behavior change communication is the need to design for scale and sustainability to achieve our behavior change results. The role and leadership of the public sector and of government agencies is central to this, not only in propelling these results, but also in ensuring that the right and conducive environment is there for this change. Never before in our lifetime have we seen this so starkly demonstrated as we have with COVID-19 and the response related to COVID-19. During COVID-19, public sector policies and actions were necessary to combat the disease. We all were familiar with mask wearing, mandatory vaccinations, social distancing, closures of public spaces, and we saw the impact this made to the progression of the disease, but also how society viewed public health measures and public health emergencies. And while we had to learn with how to cope with these public health regulations and mandates, we also developed a new appreciation for behavioral science and for the effort that goes behind behavioral science interventions to both combat the disease, but to keep us all informed. We saw the increased use, as was said in the introduction, of behavioral nudges, as well as the social pressures to conform to hygiene, hand washing standards, and a range of behavioral strategies to both inform, but also to ensure compliance in the spread of COVID-19. Again, the use of social behavior change communication is not new only to COVID-19. We know that these strategies have already been employed successfully when it comes to strategic communications for maternal health, for ensuring safe childbirth, childhood immunizations, HIV, and so many areas of work. We also know that we're still learning and consolidating evidence in what works when it comes to areas such as ending violence against children and women, ending child marriage, and addressing some of the fundamental issues facing us, such as climate change. So we are very fortunate to have our distinguished panel today with diverse backgrounds who will be discussing with us some of the factors and issues that they learned in the response to COVID-19, and they will help us to see how we can use some of these strategies and lessons in the future. So Dr. Da-costa, if I may start with you. From your experience in Ghana and in general, could you speak a little bit about what you found to be most effective in terms of communication strategies and campaigns, in terms of mobilizing society at scale? How were you able in Ghana to employ strategies that help to achieve these behavior outcomes, but really looking at the lens of how we can mobilize societies to conform and to comply with some of the necessary actions we had to see? Over to you.
Thank you so much, Madam Moderator. Good afternoon to you all. But before I start, let me take the opportunity to make some few remarks about the Ghana public health system. I mean, COVID has actually proven the Ghana public system to be resilient and robust, of which a key component is the SBCC. Now, to the lessons, I must say that, I mean, for many years, SBCC interventions are actually an afterthought. But in Ghana, I realized that this time, when the COVID pandemic came, the SBCC was on the table of political decision making. Now, what do I mean by this? So there was a presidential task force of which experts were called to lead. And the SBCC team were fortunate to have a representation like me. Now, it meant that I was able to put the SBCC agenda, tools, and interventions at the core of decision-making or political decision-making. So if you've checked carefully, I mean, Ghana is being celebrated across the world for most of the interventions that were initiated. And I must say that you could see that our president, for example, was the chief communicator or the chief risk communicator for the country, updating the population during the lockdowns to adhere to the safety protocols, carrying the people along. Now, in Ghana, what we also did was we had the Emergency Operations Center. Now, in our Emergency Operations Center, we use that as a multi-sectorial partnership building. So you see that we will have like partners like UNICEF, USAID, FHI, and the other stakeholders coming together with the Ministry of Health, Ghana Health Service expert, and the private sector on the table to discuss and find solutions to our problems, or to find solutions to the pandemic. Now, within this EOC, as we call it, the decisions we take are now carried to the Presidential Task Force for government decisions and actions. Now, let me say that the safety protocols actually, or let's say the restrictive measures, came at a cost. Now, some citizens were actually concerned about the sustainability of the safety measures, some of the safety measures like the face masks, the social distancing. But again, it also painted some negative perception about government. But saying so, there were positives. So for example, the hand washing, not only did it serve the country very well, but also it reduced other infections. So for example, in Ghana, we saw that for the last 3 years, we have not recorded any cholera outbreak. Diarrhea cases were down by 30%. So going forward, I believe that my division and the whole Ghana Health Service are looking at how to institutionalize some of these preventive measures for reduced infection rates. Again, our approach was leveraged on leaving no one behind. Leaving no one behind meant that obviously during the lockdowns, we were providing safety nets for the population. So the very vulnerable in society were given food, for example, during the lockdown. People were given free electricity. People did not pay for their electricity over months. Free water was given to people. People never paid for water bills for months. And these are the safety nets that actually came along because the SBCC was on the table. Again, people living with disability, people living with HIV and tuberculosis, we had special interventions for them. So we meet with them and we come up with collective decisions that they are part of. Then some of them actually, in terms of the SBCC materials, like the Braille and other things, it was developed by they themselves. One positive thing that came out of our interventions was also the fact that, we had a call center to address gender-based violence issues. So we worked with the Ministry of Gender and Social Protection to come up with this call center with the police and the other organizations. But the call center also served as the grievance redress mechanisms where people could obviously get information when needed. Now, in total, the government approach was an all society, all community, all government approach. Government reaction was balanced with population needs and governance needs. Then we also saw that when compliance was up, the risk perception was actually up, and I think most countries actually experienced this. Now, broad sector engagement with government leading actually helped in streamlining the efforts and improved the coordination. I also felt that, or we also saw that the Ghanaian people felt a sense of responsibility in protecting themselves, protecting their families, and also protecting the nation. That Ubuntu spirit was actually at the core of our pandemic management. So everyone had a part to play. Now, as you heard from Tad, now I've just been recently elected as the president of the ECOWAS Risk Communication, Social and Behavior Change Network. Now, speaking to some of my colleagues, I felt that some were not on the table. I felt that some of their interventions were afterthoughts. Yesterday, in this auditorium, we heard that COPS 2022 might not have included any behavior change aspect on the table. To me, this is really worrying. And this is where I call on donors, CSOs, development partners to make sure that programs do have SBCC on the table and also in the political decisions and in government. But again, let us not forget that SBCC should never be an afterthought. I will leave it here for others to continue.
No, thank you very much, Dr. Da-costa. Thank you for giving that broad sector response, which looked at many of the enabling factors in Ghana, such as leadership, social protection measures, the sort of creation of solidarity in the population and others. If I can turn now to Morocco and Monsieur Belmadani, welcome again. Thank you for joining us. Could you speak briefly about your idea of the role of government in getting societies to adopt public health measures and behaviors? In your opinion, are mandates and regulations more successful, or should we be looking more strongly at communication campaigns? Ultimately, what do you find to be more sustainable? Over to you. Thank you.
Merci beaucoup. Merci pour cette question.
Well, thank you very much, and thank you for this relevant question. Well, regarding the topic for which we are gathered here today in this panel, I would say that health policies are tending more and more towards innovative approaches in terms of raising awareness of the populations. The role of health policies is changing. It is no longer simply looking to treat diseases. It's also very much about a wider aspect of public health, which is having healthy lives and promoting healthy lifestyles and fostering healthy lifestyles for citizens. And this is where prevention becomes absolutely central in health policies. One cannot think of prevention policies that would be effective and relevant without thinking of the behavioral aspect of it all, because at the end of the day, these prevention policies are based on effective communication. And this communication can only be effective if it is based on behavioral science, on analysis, on diagnosis around behavioral science. Morocco has had very positive experiences in several health programs, such as, for example, the child mortality reduction program, on which Morocco obtained very positive results. Within 10 years, we reduced by 80% mother and child mortality to reach these sustainable development goals. And the idea was not only about investing infrastructures, equipment. No, it was much more about raising awareness, about going to people's behavior, especially in the rural areas, on the importance of getting healthcare and getting healthcare at the right moment, at the right time, because a delayed decision can sometimes lead to the death of either a mother or a child. And that's where raising awareness becomes extremely, extremely crucial. And it's at the heart of this health policy. And we at the Ministry of Health are very much determined to implement new approaches that are evidence-based and evidence-based in behavioral science in order to change behaviors of the populations and go in the direction of their well-being that aim for prevention as well as preserving the good health of our populations. And looking back at COVID, which was a major challenge for all of us, whether in Morocco or globally, communication in the framework of COVID was absolutely essential in mobilizing populations for the goals that were reducing COVID and preventing COVID. And if we look at the figures today, the figures of the pandemic in Morocco tell us a lot about how we can say that we won. We were very strong in communicating, we were very strong and good in implementing measures, but we really focused on the behavioral aspect of things, and it's really crucial to implement in our approaches these elements. As part of our action plan, as part of our communication action plan, we need to look at the behavioral science, the behavior of communication of populations, because it has a real lever effect. Many countries, for example, launched institutions and nudge teams in order to really, well, precisely nudge the people towards positive behaviors and different behaviors. In Morocco, we are still working with all the departments of the ministry to try to institutionalize this specific aspect of things and therefore nudge the population's behaviors in the right direction. As my colleagues have rightly said before me, sometimes some measures are really, really simple, such as hand washing, for example. It doesn't have to be too complicated. It's about agency. It's about taking decisions as part of a process. That's an awareness process. And as we all know, citizens and all the groups of our populations work with emotion and intuition rather than evidence and data and scientific data. And that's where communication plans need to really be in line with the scientific aspect, but also they need to go to people's emotions, to people's intuition, to nudge people's behaviors in the right direction.
Clear that in a way, as we can all imagine, both are needed. Targeted and well-informed communication strategies and plans, as well as public health measures that are institutionalized at a national level, these go hand in hand. So thank you for sharing not only the story of Morocco during COVID-19, but also the successes Morocco had in using these strategies for things like maternal and child health, where important advances have been made in a very rapid amount of time. So over to you, Dr. Saavedra. We've just talked about, we posed the question about mandates and regulations and the role that governments have in orienting these. But at the same time, we have seen with COVID-19 that at times these were rather harsh. We can also say maybe sometimes even counterproductive in the way that they were used and employed. What is the right balance between restrictive mandates and a little bit about what was being discussed here about community or consensual-based strategic communication campaigns, efforts, and programs? Over to you.
Sí, muchísimas gracias. Y bueno, antes que nada, un agradecimiento.
Thank you very much. I'm grateful to the organizers to allow me to be in this plenary session to explain what we're doing from the government in Mexico. Specifically, the system, it is very relevant. And when we talk about pandemics, one of the challenges are the regulation of mobility of the population. which was going to have implications, even social health on the population, which is used to move freely. The most important of the actions in which all countries have as an aim in the end is the safeguard of the health of the population. And one of its elements was COVID-19. That was the main thing. There was an economical question, also a social question, but the social question was also important. In that sense, we have to do actions knowing and listening to the population from the community, not from your desk. That's what we do when we are in government, in order to apply specific communication strategy. We know that the world was paralyzed. Even the indispensable things in mobility were reduced, and the basic needs didn't stop. People needed to eat, they needed money in order to live. So we had to find a balance, because it was not an individual question, but a family and community question. That is the difficult question, what is got to do with restrictive elements and the individual freedom. But in Mexican case, we've listened to the society, the companies, the individuals, the communities, the people on the street. We listen to the communities, bearing in mind the health of the population. We use 5 specific elements. First, that the population has to be informed in order to take health decisions. The best possible information, how to give them that. What we talk in our technical jargon, how to communicate that. The other thing is got to do with the understanding, the assimilation of this information or knowledge. The population had to assimilate it. And a third element was the perception of risk. It was just an imposition not to move, or there was a real risk, and that's why mobility was reduced. And the fourth challenge is the adoption of preventive behaviors in order to reduce this contagion risk. And there are other elements beyond public health, beyond epidemiology, but having to do with social sciences, other elements that where BSC has such an importance. And the fifth one is the infodemia, something where we have worked in all countries, not just in Mexico, to manage information and misinformation. We have to give the population the elements to understand what is important and not to damage the health. People needed transparency in information. At that point, which is extremely important, data of the cases were published, were open information, so everybody could access to that, something that didn't happen before. Even in the pandemics in 2009, this is something that didn't happen. The information didn't take place, but now, yes, that reduces uncertainty in the population, gives them tools to decide. What has to do with behaviors, assimilation of the knowledge by the population, there were some preventive measures that they needed to adopt, and the monitoring, the surveys were important. In the civil society, we needed to have alliances, how the Ghana friend just said, and Morocco also said that. And then alliances, another element where we had information to monitor the information. This survey that the Johns Hopkins University applied through Facebook, there was information. Only the users had access through the internet and Facebook, but it was something that allowed us to understand how much this information was identified by the population. And perception of risk, we knew that there was a question of fake news. There were fake news, misinformation, there were damage committed to the health of public. We had some training, the infodemics manager by the World Health Organization, which allowed me to have more tools and analysis to apply strategies in order to work with this element of misinformation in the population that was very damaging. Something that happened in Mexico, and I imagine that in other countries as well. People started to drink chlorine in order to the hearts, so burnings in their stomachs, direct damages to health. These are important elements when we think about strategies, and that is how are we doing it. This is our approach to communication. What is it that we use? It is the BSCC. Without that, we wouldn't be able to do a preventive work to incentive the population for them to have it as another tool, a protective factor.
Shared a little bit how in Mexico you tried to balance between restrictive mandates and these sort of strategic communications through the perception of risk, and how that perception of risk by families, the individual, humanizing it a little bit, helps you to decide where to go, especially with all the challenges you face with the info, let's say, misperceptions that were common. So thank you very much. We have one colleague who's with us online. Dr. Rizk, I hope you're with us. Sorry you could not be with us in person. It's nice to see you. Joining us from Egypt. Dr. Rizk, the question for you is a little bit to share from Egypt, where you've had successes in using social and behavior change in your national agenda. And if you could just very briefly speak to what have been the enabling factors for success in placing it, using these strategies in your agenda, and both the limitations and the success factors. We would very much like to hear from you. Over to you, and thank you.
Thank you, thank you.
Thank you very much. I know that you were speaking to multi-sector programs, which is quite tough to summarize very briefly because of all the actors, partners, levels, platforms that you use. So thank you for sharing this. I'm sure we'll try to have the next interventions be a little bit shorter so that we can make space for questions for all that you have spoken about. So thank you very much. Dr. Da-Costa, let's go back to you for a second question, very briefly, because in your first comment, you talked about how you really managed to mobilize the whole of society. Maybe if you could just really focus on how you managed to work with communities and social organizations, particularly any networks that you mobilize that remain mobilized for future pandemics, or even programs like she was talking about around gender-based violence, child protection, and others. So very briefly, if you could speak to that part about network building in the future.
Thank you so much. So building on the experience of the collaboration with CSOs, NGOs, and also community networks, I think we scale this down to the community level. Now in Ghana, our system is very decentralized, and we have something we call a program we call the Community Health Planning Systems, which we call it the CHIPS. It has actually been proven to be very effective. So what we do is that we mobilize community actors, stakeholders, community leaders, traditional leaders in a group. We come up with, we discuss issues, then we come up with solutions. And even in the ongoing vaccination exercise, you will see that it is at the community level. So what happens is these stakeholders, when discussion, are able to take the vaccines and also able to go to their families and their networks and homes and able to educate people for them also to come for the vaccines. Now, in terms of the youth groups as well, like we have various engagement with them. So we have what we call You Only Live Once, a program we call YOLO. It's a very popular program in Ghana, where we leverage on the youth involvement for scaling up health service interventions like the COVID-19 vaccination uptake, like family health, reproductive, sexual health, and reproductive issues. Now, we also use the celebrities, obviously, in the various local levels, because when they speak, obviously, they have followers, they have people who hear them, people who believe them. So they have actually been helping us. And these networks are actually in existence. The community volunteers are also very active in helping us. And these are going to be very sustainable because at the end of the day, it is embedded in the chip, obviously, chip, the chip planning systems where a strengthening of the health systems. Now, we also use the community forums where the various members of parliament speak to their constituents to scale up uptake of certain services. And that has also proven to be a little bit, obviously, good because, you know, some of the constituencies, you have them voting for the opposition party and the others voting for the government. So if you use them, they relate to them well in, and we are really using them in the vaccination exercise. We also, like I talked about the community volunteers, they've been of help to our programming. Now, what I will summarize this to mean is that collaboration with the public and the NGO sector is critical as they bring different perspective and level of engagement. Now, the NGOs do have their role, the government actors also do have their role. Now, blending the leadership of technical support from development partners, CSOs, NGOs, to deliver community level activities actually help. Now, what we also do is we co-create some of the community engagement frameworks and work together to reach communities by driving behavior and improving service delivery. So thank you so much.
Thank you very much for being brief and talking about all the actors that are necessary to make this happen. And in a way, they're co-creating some of these solutions with you is what's helping them to stay engaged and to be with you in future emergencies or societal issues. Dr. Rizk, if you're still with us, we'll very briefly ask one follow-up question on the programs you were talking about. Is Dr. Rizk still with us? Oh, you're okay. In volume, you're with us. Okay. I don't see you, but maybe just to talk about, you mentioned the important role of evaluation. I think one of the things that colleagues often face is that it's so hard to measure social and behavior change, communication and strategies, and to know, number one, to gather the evidence to inform the strategies, but then to also monitor their effectiveness and the results that are coming out based on these strategies. If you could just very briefly speak to maybe one of the programs you spoke about and how you employed, how you monitored change, how you used evaluation, and really used the idea of data. Very briefly, over to you.
just told you before, but if the process is
Thank you very much. I mean, what comes across, which the thinking was from the beginning and throughout, to try to pick certain milestones to measure progress, to do that from the outset, and to do that with so many partners around the table. So thank you. Maybe just two more questions before we open up to the audience. Monsieur Belmadani, maybe if we can just speak very briefly about the issue of funding for social behavior change communication. You know, colleagues will say here that this tends to be one of the areas that's most under-resourced and underfunded. What advice do you have to the professionals and the practitioners who work in this field to draw more resources to this? And how can governments, let's say ministries of health and others, ministries of finance and everyone else, be more supportive, given that we've spoken about how important public policy engagement in a social behavior change communication is? What advice would you have based on your experience? Over to you.
Effectivement.
Yes, the question of funding is absolutely crucial. I'd say that we need to shift paradigms in terms of funding. It's not for each sector to look for funding, or we should not be looking in various sectors. We should neutralize the funding. Communication actions, awareness action for social and behavior change are multifaceted topics, multifaceted actions, and this is why coordination, cooperation between the different, the various departments, the various ministries, and then the exchanges between the government and civil society with the support from international cooperation. You see, it's something that needs to be pulled together. Our entire approach on reaching results depends on that. Of course, funding is important, but it needs to be looked at in the framework of results-centered approach. And that will help us and allow us to be effective and efficient. Of course, we want to reach our goals, but we need to have a cost-effective approach. And that can only be done with pooling of resources with horizontal projects. For example, in Morocco, we have sectorial policies with their own budget, working on their action plans, but we also have at the same time horizontal initiatives, cross-cutting initiatives, such as the National Human Development Initiative, which is a cross-cutting program which is currently undergoing its third phase to support social actors in health and the environment, and it supports everything that's being done by the various ministries and departments in order to foster those sectorial strategies. We also have launched a program to reduce social divergence in the social and rural areas to try and remedy the inequalities that may have appeared or that may appear when we launch and implement sectorial strategies. We have also launched quite a vast project launched by His Majesty the King. It's on social protection. And the first pillar of this project is on generalizing, mainstreaming social protection. And all of this was done and funded through effective financial management and looking at various sources via the government, and also with the idea of contributing. The populations who can contribute will contribute and did contribute. And this is where communication is crucial, because the question is, how do we bring to the table people who did not have social protection? How do we bring them to participate in this social protection scheme? This is very important because the population is very specific. Those who did not have social coverage, so social protection. So we need to communicate adequately with these people. We have adapted our language, we have adapted our communication to change the behavior of certain people so that they can participate in social benefits and participate either on a monthly basis or for someone who is an independent worker or a interim worker. They don't have a monthly wage, and therefore they may require another type of participation. And this is how we need to adapt our communication to the people we are talking to, so that we can encourage them, nudge them into participating in such a major program. So once again, I truly believe that financial resources are important, yes, but they are not enough, they're not sufficient. And of course, we can pool our efforts, mobilize efforts of all partners with several financial sources and margins that can participate in social and behavioral change.
Last question, but I think the point about funding actually is not something that is any single entity's or population's responsibility, but that if it's construed as something that is inherent in achieving positive outcomes in behavior, then it is a responsibility of all of us to be contributing to the funding that is necessary, whether it's societies themselves, whether it's all ministries, not just, say, the public health department, or ministries of finance, but truly, and you gave some good examples in Morocco of some really flagship cross-cutting programs that have embedded this idea of social behavior change at the heart of the program, thus making it easier to recoup some of the funds that are necessary. So thank you. Perhaps the last question is about all of this has talked about multi-sector coordination, multi-sector communication to put together evidence-based social behavior change programming. In your experience, Dr. Saavedra, what is necessary for good coordination mechanisms? What are the enabling factors for that? What do you know to work from your experience?
Muchas gracias, la verdad que muy interesantes preguntas y totalmente estoy de acuerdo tanto obviamente con
Many thanks. Your questions are quite interesting. I absolutely agree with my colleagues from Ghana, Egypt, and Morocco. Cross-cutting work is essential and crucial when we look to provide responses in public health, and communication is very much a part of that. Of course, there are mutual influences, so for governments question of budget often is the most difficult one. And we don't always all have the same priorities, and we don't always have the same priorities as those who are in charge of distributing the money, really. So we need to find the right balance, strike the right balance between our different interests. What worked in Mexico? What lessons can we draw from the pandemic? Well, I believe it applies to all health systems throughout the world, and that is we need to work in a more coordinated manner, in a collaborative manner. Our resources are limited, and they're never sufficient enough to respond as we would wish to. That's one thing, and then communication. We worked on communication, we worked on communication and social and behavior change communication, but that was in times of peace, in times where everything was smooth. And in the times of pandemics, things are really different, and we need to think of these two scenarios. That's the specificity of Mexico, actually. Our budget lines include a crisis line. We had something that had to do with motherhood, health, we have lines for all these things. We did not have sufficient money saved or planned for crisis management, and that's absolutely crucial. We need to work in cross-cutting matters with NGOs, with civil society, with the international organizations who have provided us such support, namely the WHO or UNICEF on risk prevention and other topics, also related to behavioral change. And all of these partnerships, all of these people we reach out to, institutions that we reach out to, help us strengthen our work capacity on a regional as well as on a national level. We also need specific health resources. That's another important element. Then I should like to highlight that within ministries, the Secretariat of Health, for example, with the Secretary of Health, we need to cooperate more. There are areas, of course, with more resources in terms of public health, but sometimes it lacks the idea of communication around social and behavior change. And we are left in charge. We are left in charge of promoting health, but they never invest. They invest for hospitals, for big drugs, for big hospitals, but not for social and behavior change. It seems that social and behavior change is not always very appealing to everyone. And so the budget for communication needs to be adequate. And so in terms of scenarios, I told you about the various possibilities and the idea of having a specific budget line for crises. But there's also, for example, the epidemiology surveillance. When our monitoring, when we have information that comes from epidemiologists, we need to translate that into a language that can be understood by people. Let's talk about hand washing, for example. Sometimes it's not that easy in rural areas with little to no access to water. So this needs to be translated into things that are doable, realistic for the population, and understandable for the population. Now, for the pandemic, we created a working group to draw lessons from the pandemic, and in this working group, we have a communication aspect, which is cross-cutting. And it's really something that we learned from the pandemic, which helped us to really upgrade in interventions on the ground in service management. And we now play a very important role. Moreover, communication needs to be adapted. We have strengthened in terms of health promotion, something that is the laboratory of risk communication. What does it do? Well, we have a team working on communication, precisely. And as part of this team, there are multidisciplinary experts in communication, illustrators, designers, graphic designers, epidemiologists, doctors. And so we have a certain level of expertise in health intelligence and health knowledge to try to nudge the general population, to try to implement change. It's not easy, true, but if we base ourselves on analyses, if we base ourselves on monitoring what we have, then we could implement much more easily mechanisms and solutions that work for everyone. It has not been done. We've been working with international organizations, support such as WHO, regional offices, the Pan American Health Organization, and it can sound appealing, but with limited resources, it was very difficult. And so we need to put our money where our mouth is. Thank you.
Thank you very much, Dr. Saavedra, Dr. Belmadani, and Dr. Da-costa. Thank you so much for those very brief and rich examples. I think we have a good amount of time for questions from the floor, so maybe the lights can be dimmed a little bit so we can see you, but there's one over there, I think there are folks with microphones going around the hallway, so, yeah.
Good evening. Assalamu alaikum. Dr. Mohammed Fall. I'm from Mauritania. First of all, I have to congratulate the Minister for the victory of Morocco. So I have a general question. So the question is what kind of approach or engagement this kind of summit can add as in the relationship between the public sector and the private sector, or if I can say the NGO, the NGO sector. That's the question. Thank you very much.
Thank you. Maybe we can take 3 or 4. Yeah.
So this is Rajiv. I'm from New Delhi, India, and I work on child rights. I'm a social pediatrician. And while I heard the distinguished ministers speak about health, very few of you touched children, and very few of you touched violence against children, which is a huge public health problem. Even the WHO says they've come out with inspired strategies. Violence against children will lead to long-term effects, including non-communicable diseases and adverse childhood experiences. I wanted to know what planning you have for that, especially for children. Working together for health, protection, development is essential in the need of our, particularly in the low middle income countries. Thank you.
Maybe something from this side. Yep.
Thank you. So my name is Hadir, and I work in UNICEF. I'm a social behavior change officer from Iraq. So my question is about the public sector, multi-sectoral work. So usually the ministries are a very stand-alone, they stand very strong on their plans and their implementation. So when we do a multi-sectoral plan, like strategies and action plan, how did you manage to ensure that the consistency in implementation and also reporting, and that all entities were always briefed about the progress and the results throughout the process? Thank you.
Apologies, I also didn't thank Dr. Rizk for her contributions during the sessions. Thank you very much. Okay, so we have one question around the public sector and private sector, one around violence against children, although we had quite a few examples from Dr. Rizk on how they were working on this particular issue, and then on how multi-sector coordination work has been going. Let me offer you the one you want to answer. Why don't you start, Dr. Costa?
Okay. So thank you so much. I think I'll take that children's involvement. Now, let me say that, I mean, in Ghana, some of our targeted programs were actually focused on children. So we have the school health programs where we specifically target children in schools. Now, you all remember Captain Planet. Do you know Captain Planet? Raise your hands, those who know Captain Planet. So Ghana, we have come up with our own version of Captain Planet, which we call the Kofi Commando. And it is this Kofi Commando is a tattoo type where children are able to learn the safety protocols and also obviously use it to even encourage their family members and their colleagues in school to actually get vaccinated. Let me say that our vaccination exercise actually includes 15 years and above. So you could see the dynamics here. But we actually work with the NGOs, CSOs, like UNICEF, for example, you know, their area also deals with children, and we work with them with these targeted interventions, including violence against children, women, and others. Thank you.
Thank you very much. Dr. Rizk, did you want to comment the question related to that? You know, you talked about working with health, with child protection, with all these sectors specifically on violence against children. I think the person who's asking the question was talking about how violence against children has really become a public health crisis. So any insight you can share on that? Over to you briefly.
Thank you, Dr. Naseem. Actually, yes, I really would love to share this story, because it's really, you know, to have like those ministerial bodies working together. It's something, as my colleague from UNICEF have just mentioned, it seems at the beginning it's complicated. However, in every one of the ministerial body, they have like mandate with action plan. And what we do is having a national committee that comprises all those ministerial bodies with their action plans, dates, and they keep reporting on themselves to this national planning where they are member. And the Ministry of Planning and Economic Development for example, the Family Planning and Development Program, it's leading this, it's the coordinator, which will have a coordinator and sub-bodies, sub-ministerial bodies. They have their mandates with their action plan. They keep monitoring, they meet actually monthly in order to discuss the bottlenecks, and how the interventions works. Something that is really very worthy to mention as well. It's not only in Egypt starts by doing such kind of flagship programs and combining different ministerial bodies, but also as well it's a regional. So we during the COP27 we launched Live Africa, which we have now. We are in the phase of the South-South learning and sharing experience, what we did in order to improve rural communities in Egypt, to do this in Africa as well. So I think it's more about disciplinary, it's more about reporting, monitoring, and evaluation for their pillars. So if for the economic empowerment, if we mention that this is the Ministry of Social Solidarity is in charge of this pillar, so they do reporting for the process evaluation to the national committee every month. They have a meeting every month as well in order to discuss what's going on, what are the bottlenecks, and what are the actions that need to be taken in order to overcome this, and so forth. Thank you very much. Back to you, Seema.
Dr. Saavedra, we want to speak very briefly about the coordination piece, since you already talked about it. You know, I think the question was, how really does it work that information truly is shared, that people feel engaged? You know, how are you really making it work? Maybe over to you.
This is very important information, how to guarantee the multi-sectoral elements in our work. We need to have a way to work in between different institutions. That is the importance in intersectoral work. We need to have that clear, but we have some elements that we agree. In this work, for instance, what Dr. Da-costa said in terms of child health, we identify the process we can take care of in each area, and each one in its competence can work. That is something that we work on. Everybody has got something to do with health in his own field, which elements to pay attention to in order to work on that specific element. In Mexico, there is something which has to do with children and infancy, which is very important. It is an intersectoral work, a very big piece of work. We know it as CP Lima in Spanish. There are 20 government institutions working for the rights of boys and girls in Mexico: health, education, safety, and each element is identified in each of these areas, identifies which are the strategies, objectives, and they are including the budget elements and belong to each of the areas. And in transparency, they are included because they are big plans that it is signed by the presidency of the government to identify these elements, and you have the budget, the objectives, with a common field having to do with each of the government entities in order to work in that sense. And within all that process, it isn't just talking about health and education, but also things having to do with communication, changes in behavior, what is needed in that sense. Violence, which is important. In COVID-19, we've seen how family violence has increased at home because we were saying stay home. So the aggressor for women and girls, the aggressor was at home. So that is an even greater urgency. So in general, the way the work is done, we need more time in order to identify each of the points and how this health element is taken into consideration in each of the policies.
And Dr. Belmadani, maybe you want to add on this public-private sector relationship. You can even use the example you were talking about and how civil society and the public sector are working very well together, or any other example you want to give.
Thank you. First, allow me to express my gratitude to our friend from Mauritania for their congratulations. And a behavioral change has happened to the Moroccan team. This is what allowed them to reach the level that they reached yesterday. Go Morocco. I believe that today's question, if we have one recommendation that we should draw from the work of this international summit, it is clearly to strengthen the work, accept diversity. The topic of diversity is its strength. Diversity exists within the government, within the different departments. So it is an excellent opportunity to strengthen the work of every sector. And we need to create an entity, a central entity that will coordinate the work of the various entities, because there is an expertise at the public level, at the level of each department, at the level of the private sector, and we need to take advantage of it. So on this particular point of behavioral change, of awareness to SBC, this has been done, but we will need to create an entity that will coordinate the communication work, the behavioral work, that will draw on the expertises that exist with various departments who reacted with success to COVID, is that diversity, that complementarity, because everybody's contributing this expertise, but then we need to coordinate and institutionalize it. So entities are in charge of these communication issues on behavioral change. This has to be institutionalized and provided with a clearly defined mandate, clearly defined objectives, so those objectives can be reached, because the impacts and the results are tremendous. As our friend from Mexico said, as far as the Ministry of Health, you have a number of sources of financing that are granted for investment purposes. It's considerable, but we cannot reach the impact of these financing if they are not matched with a targeted communication in order to allow the various citizens, the various populations to take advantage of it.
Better note than having come back to the theme of the whole conference around diversity and the comparative advantage and role of all of us. So thank you very much. I'll hand it back now to our organizers to close up the session. Thank you very much.
Thank you, Anna. Ladies and gentlemen, it's been an exciting and interesting discussion by our distinguished panel and moderator today. We've heard many different things about the importance of public sector being part of the being in leadership role, but the importance of multi-sector, thinking outside the box. We're living in a post-COVID, hopefully, post-COVID world where COVID-19 taught us all the importance of social and behavior change, communication in an epidemic and in a pandemic. And it's also taught us the importance of taking these lessons and incorporating them going forward in true partnership with leadership of the public health sector, the integration of NGOs, CSOs, other organizations, as well as the private sector. There are many points from today's discussion, and I hope you took away from this discussion some key insights and some important trends for the future. Ladies and gentlemen, let's just thank once again our esteemed panel and moderator for a wonderful session. Let's give them a round of applause, please. And as you depart today, please do consider some of the things that are talked about today. As many of our speakers talked about the importance of this collaboration and multi-sector engagement as we better integrate social and behavior change across the platforms and across all interventions. Let us go forth in thinking of some of the lessons and some of the points that our panel made today. Thank you very much, and please enjoy the rest of the conference.